I'm going to share my screen here. Are you guys able to see the screen okay?
Yes.
Okay. Well, today we are doing a professional webinar on clinician well-being for the Path2BSN students and also for faculty in our different partner schools. And I am Dr. Tracy Taylor. I'm the Path2BSN Nurse Educator Liaison for the PATH program. And so we're really excited to present this today. It's a very hot topic. It was a hot topic well before the pandemic, so just very important. Just some general background information. The pace and intensity of work in the healthcare environment is definitely on the rise, and of course it definitely is now. Our nurses are facing pressure. They are managing increasingly complex populations while still trying to address some new policies and regulatory burdens, financial type of barriers, and human resource constraints. So some of our novice nurses are already reporting feelings of being overwhelmed. They feel like they're unprepared to cope with some of the complex psychological, social, and spiritual care needs of their patients already. We also have nurse leaders that are being challenged to provide rapid, but they have to have well thought out decisions in an environment that's just morally complex right now and very challenging. So regardless of your role as a healthcare worker, there are new expectations and challenging work environments that can really place you as a clinician at high risk for burnout and stress-related sicknesses. So even before COVID, this caused for concern. There was a direct and adverse relationship between negative stress and productivity and engagement in the workplace. So we had chosen this webinar before COVID, and because it was a very emerging, urgent, hot topic coming up in the healthcare environment. Okay, the importance of well-being. We know that 35 to 54% of clinicians have substantial symptoms of burnout. And the Ohio State University in October of this year presented the second summit. The summit was on promoting well-being and resilience in healthcare professions. And the summit really focused on healthy lifestyle behaviors of clinicians and health science students. So we felt like that really applied to our PATH students and faculty and partner schools. We're going to watch a very short video clip from the summit, and the clip starts out where they're talking about the top 10 reasons of how organizations, whether it's a healthcare environment or a college university environment for students, can be very supportive of clinician and student well-being. And this will be presented by Dr. Bernadette Melnick, who is the Chief Wellness Officer and Dean of the College of Nursing at Ohio State University.
Culture eats strategy for breakfast, lunch, and dinner. We Buckeyes love competition. And this was our former president, Michael Drake, during our last challenge with that school up north in Michigan. We had a physical activity challenge and we beat the school up north, which was great. But again, our top leaders, also including Gene Smith, our athletic director, they all buy in. They walk the talk, create a menu of options. Not everybody is going to want to engage in the same types of programs and activities. We have an exhausted menu of options that people can choose to be engaged with. Lesson number 8, make it easy and fun to engage in good self-care. This is our OSU Just Breathe initiative. And these clinicians did a great job creating a theme, having fun to get stress levels done. Lesson 9, communicate often in clear, engaging, and emotional ways. Evidence alone is usually not enough to get people to change their behaviors. The communication strategy is critical for engagement in an organization. Policies can really help within an organization. Our medical center just was successful in getting a new policy passed to provide Buckeye Paws, a pet therapy program for our clinicians. So I want to conclude by saying an ounce of prevention is worth a pound of cure. We still live in a very sick care focused healthcare system. We're always going to need sick care, but we need to begin to shift the paradigm. Culture eats strategy for.
Sorry about that. The ounce of prevention is the cure. And so I wanted to include this part from the summit to show you that some of the organizations are really putting a lot of support financially, emotionally, and physically in their employees and their faculty and their students on maintaining well-being. They realize that prevention is definitely a way for the cure. And I thought that was a really good example to kind of show you some of the different things going on.
Culture eats strategy.
We'll go on to the next slide. So I want to talk for a few minutes about barriers. And one of the terms that you may hear when we talk about clinician well-being is nurse fatigue. And this can be student nurse fatigue also. And so this is a statement of position from the American Nurses Association that registered nurses and employers in all care settings must collaborate to reduce the risk of nurse fatigue and sleepiness associated with shift work and long work hours. Evidence-based strategies must be implemented to proactively address nurse fatigue and sleepiness to promote the health, safety, and wellness of registered nurses and to ensure optimal patient outcomes. So their position is that employers and organizations need to be invested too. When we talk about nurse fatigue, we want to kind of define what that is. It is defined as a tiredness that can occur during any shift, and it may be caused by inadequate sleep. It could be caused by long shifts, the physical demands you have during that shift, and then also scheduling issues, back-to-back schedules, switching from days to nights, things like that. You may also hear the term compassion fatigue when we talk about fatigue. And that is workers in the healthcare environment that are involved in direct care of patients that are exposed to chronic and suffering and negativity on a daily basis. And so they face those increasing demands in the workplace. At the same time, they're struggling at home with family life, personal interest, and oftentimes they're caring for their own children and aging parents as well. And so this can take a real toll on those clinicians' health, on their relationships, and it can affect the workplace. And we see that with low morale. We see absenteeism. We see a decreased motivation and apathy. Though people are suffering from compassion fatigue as caregivers, they still love their jobs. And so they're working in an area that they love and that they're passionate about, but the toll of the being exposed to the chronic suffering and negativity and that struggle to juggle everything really just takes a toll on them. Another barrier, you will hear the term nurse burnout, and we can have student nurse burnout also. And burnout goes all the way back to the 1970s. It was described as the result of stress among people in a helping profession like nursing or medicine. And nowadays we could expand that to include occupational therapy, physical therapy, dental. So a lot of different areas where you are a helping type profession. And they define that by three characteristics: exhaustion, alienation from work type tasks. So they really want to separate themselves from work type activities and responsibilities if they're suffering from burnout. And then also we see a reduced performance or productivity in those types of nurses. And nurses in this environment today, a lot of them are being required to work overtime, and they may not have a choice, especially now in the pandemic. Many units and organizations order mandatory overtime, and so long hours, poor staffing. And we had poor staffing before the pandemic due to a national nurse shortage. So that on top of this can be really taxing. Burnout, it develops after that clinician experiences chronic and excessive stress without having adequate coping mechanisms. And some of the consequences where the nurse ends up having fatigue or burnout syndrome are very serious. And when a nurse reaches that burnout point, sometimes they can't recover from that. And that's when we start to maybe lose some people from our profession. And so we may see effects of this could be the low morale on a unit or organization. We may have clinicians that turn to negative behaviors such as overeating or some substance type abuse. They also may have negative coping mechanisms. And then again, we'll see that absenteeism. We have a quick turnovers at organizations, and then also that low morale. We want to include the patients in this also. Having that nurse fatigue, compassion fatigue, and nurse burnout can also directly affect patients that we're caring for. And so patient safety is one of our most important issues across the world. And nurses and clinicians play the key role in that. And so we need to provide a good working environment and identify interventions that we can use to prevent and treat emotional exhaustion of our clinicians so that we keep our patients safe. And just a few examples here for patient safety: falls, central line infections, medication errors. And we know that medication errors are in the top leading causes of death in the United States, and many of them are preventable. And so providing that type of organization that recognizes prevention and provides resources to create that well environment is very key. We also know that clinical outcomes are affected. So if our patient safety is affected, then that affects the clinical outcomes of our patients also. Burnouts can take a toll on workers, and it just can lead to lower quality of care and then the errors that can occur. Many nurses report in various surveys that they admit to making mistakes or errors when they're tired. And then they also can have a reduced ability to be empathetic towards their patients and their families. And they can also show some emotional symptoms like sometimes anger, resentment, anxiety, irritability, poor concentration, and all of that can lead to that compassion fatigue, which can affect our patients. I wanted to include a small area about COVID-19 because this is something that we could not have predicted coming in our healthcare environment when we started talking about clinician well-being. And so in general, around April 20th, 2020, is when COVID really impacted the healthcare environment. There were more than 2 million people worldwide positive for COVID-19, and we had over 200,000 deaths. And so these numbers have drastically changed since then. But just to point out that at that time, this caused a great need for hospitalizations of thousands of people. It put a lot of pressure on staff. Pressure on staff was compounded by a lack of adequate PPE. We know that there was a national global shortage, and that was a lot of pressure on staff that knew they had to work without it or with limited amounts. We already had staff shortages. We had a shortage of beds and then also a shortage of mechanical ventilators. And so that put a lot of pressure on staff. And we also know that there were some challenges. Critical care nurses are not the only ones affected, but they were particularly affected by severe emotional distress, just being associated with developing that developmental compassion fatigue or burnout. The emotional impact, they witnessed prolonged suffering of patients that were isolated, patients that died alone. Evidence has shown that staff can have psychological problems when already working in a stressful environment. And then when you add disasters or pandemics on top of that, it's a real challenge and also emotional impact. Some of the other challenges they faced was there was such an ease of transmission of COVID. We weren't really sure exactly how it was transmitted, and things changed daily, hourly. And they still had to work in that environment. There was a lack of immunity among global populations. Nothing we could do about it until, as they were working on the vaccines, there was delayed testing, limited medical equipment again, and then an uncertainty of what the trajectory of the pandemic would hold. And overall, just a general level of anxiety within the community. All of that combined really puts a lot of pressure on the health and welfare systems and on healthcare clinicians. And so we have all read or know of coworkers or situations where they describe things such as all the COVID patients died on their shift or their unit in just one evening. And so the effects of this is really hard to imagine for those healthcare clinicians. And many nurses in this situation probably did not have any support at the time. We're still figuring this out. And so there's going to be a lot of impact on our clinicians that have worked during this time. Okay, I want to start talking about self-care. And this is a short clip from the Director of Undergraduate Health and Wellness at the College of Nursing at Ohio State University, Dr. Kate Golick. And she is going to go over just some brief areas or topics that are great for self-care and some areas that you can use as a student when you're working as a nurse, a new nurse, and that you can share with your family, friends, and your colleagues. So I hope you enjoy it.
Hi everyone, my name is Kate Golick, and I am so excited to talk to you just for a short while today about clinician self-care. So I know that all of you are nurses and you are probably going through a lot right now, especially with the COVID-19 pandemic. And so I think this is a great opportunity to just kind of think and reflect, about yourself and, what you can do to keep yourself as healthy as possible during this time. I just want to go through some quick evidence-based strategies that can really help to, get you through this time and hopefully through the duration of your nursing career. I really liked this infographic. I feel like it has a lot of really important things on it as far as ways you can practice self-care. So just taking that break, take your break at work. Don't be a martyr. Don't be somebody that can go 12 hours without going to the bathroom. Take your break. And when you have that break, allow yourself to mentally shut down. It's so important to be able to do that and step away and actually have, again, that mental break. Eating well and staying active can do wonders for your mental health. The aspect of eating well, I think, is very underreported. The clarity that you can get, how much sleep is better, how your mood is better, all of those different things when you're eating well. And the same goes for physical activity. Try to really focus on what you're doing when you're doing it. So that's part of being mindful, right? Is staying in the moment, being present in the moment, whether you're at home, whether you're at work, being able to do that. So leave what you have at work and leave what you have at home and stay in the moment. And that'll really help you when you're out in the field working. Be curious, set realistic goals. Be able to laugh at yourself. Keep up laughing with colleagues and keep things light. Don't take things too serious. All of those things can really contribute to your mental health. Do something creative. Be fun. Do things when you're not at work where you can go out and really just have a break. And then really important is asking for help when you need it. There is no shame in realizing and coming to the conclusion that you might also need help. So just a couple other things. I emphasize to take breaks. Respecting differences. So some people handle things differently, right? Some people maybe want to talk everything out, and some people might want to just process things alone. And either way is okay. So just respecting those differences within each other. Stay up to date with trusted information. And then, give yourself credit. Honor the service that you're doing and how noble it is. Practice gratitude on a daily basis. And wherever you are, whatever you're doing, just know that you are doing a great job and you are really contributing to healthcare and moving us forward and getting us to another better place. Hi, everyone.
So I hope you guys enjoyed that. I thought the infographic could be used in a lot of different environments, especially the student environment. As you are in clinical sites and you are working as aides and assistants as you're going through school, and then as you enter your new role as a nurse. Those are all very helpful and mindful things to keep in mind. I also wanted to give you a list of some self-care strategies that we can add to that. And so exercise, which Kate mentioned, physical exercise is very good. Healthy sleep practices. We know that we should be having 7 to 8 hours typically are the guidelines for sleep per night. Mindfulness activities. So things like meditation, deep breathing. There are lots of different mindful activities and resources available. Enjoying an activity. So something very small, like just reading a magazine or a book, all the way to a large activity like a hike or a bike ride. Do something that you enjoy. Make time for yourself. Stress reduction courses. There are virtual courses, in-person courses. There are correspondence courses, lots of different ways that you can get resources on stress reduction so that you can develop some of those positive coping behaviors. Counseling services. Most universities, colleges, and healthcare organizations offer counseling services for their employees and their students and faculty. Take advantage of those. Many times those go unused and they can be very helpful. They can also provide some other resources for you. Employer support of work and family relationships. This is something that we have to sort of change the culture of too. As you saw in the summit, organizations that support that and provide resources for that are going to really help in a clinician's well-being and help decrease some of that stress. Resilience. Resilience is that inner strength that a person has that enables a positive stress response. And so the resilience can really be enhanced and supported by some of these external sources. Relaxation, just taking 5 minutes to unplug from technology, especially in the virtual world that we're living in right now. Taking that 5 minutes for yourself, do some deep breathing exercises for that relaxation. Finding that work-life balance, and that's something to learn as a student and as a nurse. Debriefing. Debriefing is very important to do after a patient situation that was difficult, a shift that was difficult, an experience that was difficult. And sometimes debriefing takes place immediately, and sometimes debriefing can take place a few days later, but very important to talk through with either colleagues or a manager or mentor that you have. Self-reflection. Lots of people find self-reflection, journaling, just going through the process of positive and negative things sometimes is really helpful to decrease some of that stress. Humor. Humor is a great way to cope with stress and develop some behaviors, and also a way to socialize a little bit with other people. And then use of a support network. So right now with a lot of things being virtual, our support networks have been severely impacted. And so just remembering that we have phones and email and Zoom. We also have clubs and organizations that have continued to try to provide that support to their members and relationships throughout this. And so please take advantage of those and reach out, because they are out there. The ability of a nurse to provide distance from the work environment is really vital to healthy coping. So being able to do some of these things each day are really going to enforce that positive coping mechanism. Also, in the importance of well-being, I wanted to focus just a little on these 3 areas. So students, you are impacted by what you see in the clinical environment, which at times can be described as topic, as stressful, as difficult. And so also you could be at an organization where the environment or culture is toxic, and that can really accelerate some of that burnout, fatigue, and stress. And so just knowing your resources, reaching out to your instructors and your teachers and your resources to talk through and debrief about some of those things are really positive for students. Also, faculty. A couple different medical schools, including Ohio State, have kind of altered their course structure to offer courses or programs that can alleviate student stress. They were first initiated to eliminate student stress, but ended up impacting faculty as well. So things like mindfulness programs, wellness programs, initiatives for students and faculty. It's a great way for faculty to have an importance of well-being is great modeling and mentoring for the students. And then professional impact. So for people that are in a helping profession, just knowing early recognition of some of those signs of fatigue and burnout and trying to improve your self-care, both in the workplace and at home, is really key to creating wellness. Many times as caregivers, we focus on others at the expense of our own well-being. And we understand this concept intellectually, but the knowledge doesn't necessarily lead us to taking better care of ourselves. So we need things we need life outside of work, and that includes daily nurturing for our own wellness. And remember that taking care of the mental health of clinicians directly affects our ability to serve our patients. And so when that burnout affects other members of a healthcare work team or workforce or unit, it can feed on each other. So, the physicians and staff and nurses and aides, if we have low morale taking place or a toxic culture or environment, can really feed off of each other. So remembering to role model and be that role model for clinician well-being. I wanted to talk a few minutes about resources. I know we've mentioned that a lot, and there are a multitude of resources out there, but I wanted to kind of point out these three are very easily accessible and might be a way to get started. And so the first one is the American Psychiatric Association, or APA. They provide resources to individuals and to organizations. And some examples of things that they provide would be TED Talks for burnout. They can provide resources on provider resilience. They also have a Well MD Center where they have a lot of different organizational tools. So from the organization side, if they're looking for things to do for employees and staff, the CDC, the Centers for Disease Control and Prevention, has well-being concepts. And so that links you to resources and content for well-being. And then finally, the American Nurses Association. In May of 2020, they launched a national well-being initiative for nurses, and it was designed specifically for nurses across the US to help them build that resilience and take necessary steps to manage the stress and the trauma that had started to be caused by COVID-19. It gives nurses access to resources for digital mental health, wellness related sources, tools, and support for emotional well-being while taking care of people that have been affected by the virus. This was developed by nurses for nurses. They joined forces with the ANA, the Emergency Nurse Association, the American Association of Critical Care Nurses, and then the American Psychiatric Nurse Association. And so they also provide resources for mental health for supervisors, not just at the nursing level, so different levels, supervisors, organizations. They provide a hotline and support groups that include topics for home and work. Well, that concludes the information on clinical or clinician well-being. I hope you enjoyed that. There is lots of information out there, especially as we have been going through the pandemic this year. And so I just encourage you to reach out to your organization, to your college, to your university, and take advantage of some of those resources out there. If you have questions, you can always contact us and we can link you to some of those resources. But remember that being well for yourself is being well for your patients and your family. And that is a great role model and a great way to help you be resilient as you care in the healthcare environment.